Now we have the symposium with the first keynote lecture to be delivered by Mr. Wyman Lee. Mr. Wyman Lee is the Chief Operating Officer and Director of the HKSH Medical Group and Director and Manager of Hong Kong Sanatorium and Hospital. And he is going to tell us something about towards the next centenary.
All right, thank you very much. Firstly, I'd like to correct a misconception. The misconception has always been that the Dr. Li Shifan is the first medical superintendent of the Hong Kong Sanatorium Hospital. Okay, for your information, the hospital was founded in 1922. 1922, Dr. Li just finished his FRCS in Edinburgh, and he returned to Hong Kong, and he was recruited by Dr. Paul Todd, the father of the famous David Todd. He was recruited to run the to bring the Kung Yi Hok Yuan into becoming a university. So he spent the next few years on his life running as a dean of the Kung Yi Hok Yuan. Now the Kung Yi Hok Yuan has now been classified, has been taken over as the Zhongshan Yi Hok Yuan. So that is the history. So in 1927, 28, around that time period, he returned back to Hong Kong, and then he resumed his as a medical superintendent. So technically, he is not the first superintendent. Now, who the superintendents were at the time, we don't have any record. Okay, so but we have a continuation of the lease through all these years. Now, for us to continue, now, firstly, I'd like to announce the sad passing of Mr. Henry Hui, who has long been a member of the board of directors and the senior management for the past 40 years. And his services will be sorely missed. Okay, to go forward, we need to go backwards first. To look backwards to see where we were. In April 2008, we received the occupation permit for the phase 3 building, which is where you're sitting on now. You're actually sitting on phase 1. The top of the building is phase 3. Okay, so when we were building the building, the last part of building the building, we started a design process to look and where we go from here. And that basically, the building that you see composes of the central block and the fan block. The original scheme was that when we finish with a phase 3, we will move all of our services over, and we will tear the whole building down, and we will go from this point. And we would have added another 500 beds to our total capacity. And also at the same time, we were planning a proton therapy to be buried in the basement. And the building design plan was submitted to the government, and we were waiting for the final approval. Unfortunately, in 2008, the town planning decided to zone the hospital site with a restriction of 12 stories. Now, there's a lot of issues with the legality of whether they can do that or not. Okay. However, what happened next was we settled down with then the head of the DOO development office and negotiate a split building, preserving the total GFA of the hospital. Okay, now mark the date is 2009. And because we settled the case, we assumed that we would be able to build. It's now 13 years since the settlement. We have done a design building with a TKA at the time. This is a rendering of the building. So we have been looking at where do we go from this point. We have plans. Okay, we have only just received the final lands department approval for the lease modification. We still don't have the lease modification yet, meaning that until we do the final lease modification settlement and all the terms and so forth, we are stuck with the Happy Valley redevelopment. So if you ask why we didn't move in the last 15 years, this is the primary reason. We got stuck by the government. Okay. Now, because we knew we were going to be in trouble, one of the most important things we did at the time was to look at what are we going to do with the proton therapy. The proton therapy requires a very large space that we need to build on. So so very soon after the town planning issue, we purchased a lot in AKN, Nga Kong Nam. Nga Kong Nam is resting on solid granite. Okay, we purchased the building, tore it down, and redeveloped it with a proton in mind. Now the building basically is finished. We have received the occupation permit, so we can move in. The proton is now being has been delayed for 2 years due to COVID. The reason for the delay primarily is the material. We cannot get the material down from China, and also the machine is designed and built by Hitachi, Japan, and they have problems bringing their staff down into Hong Kong. However, they have a very, we would like to thank Hitachi engineers for braving 21 days quarantine that they had to do at the time. And now it's a little bit better, but at least 2 groups of engineers had to endure the 21 days quarantine. And now it's in the final testing and commissioning. And in early 2023, next year, they will hand it over to our teams, and we will they will be doing the final testing and commissioning. The scheduled first patient is July 1st, 2023, barring circumstances beyond our control. However, when we first did the proton in AKN3, we look at the building and we come to the conclusion that just on one single building is too small to accommodate all the things that we want to do there. So we purchased the building next door, the AKN5, which was an industrial building that we converted into the current look. Okay, it's now the lower building. In June this year, we went to the town planning a little while ago, and the town planning finally approved, quote, hospital use under column 1 of the OUB1 zone, meaning that we can now use it as a hospital without going through additional town planning process. Originally, we did not anticipate this for another 2 more years. Now that we have it, we can now go ahead with the planning. What we are at this point, we are waiting the final lease modification terms, and that might take another year to year and a half to do. In the meantime, we're spending a lot of time and energy in redesigning the whole of both AKN 3 and 5 to see how we can make it work as a hospital. The combined 2 buildings will consist of a 200-bed hospital. Now, I'll give you the scale. Happy Valley is around 550 beds. Of the 550 beds, we have maternity and we have pediatrics. So we have Happy Valley, we have about around 400, a little bit over 400 beds for general patients. The combined AKN is about half of that. We have radiation bunkers, and we are now targeting the hospital license around. Okay, sorry, I have to revise that. We are anticipating 2024, which is a little bit ahead of the time. So we will gradually populate the whole building gradually, a little bit at a time. Okay, what does the Eastern Medical Center compose of? A 200-bed hospital. We will have 8 modern operating theaters. We will have comprehensive CT, MR, PET scanners, MR, NM, PET, and including the cyclotron lab. We will have a full suite of CT and MR simulators. I think we have the largest number of MR simulators in the world in one place. We have at the present moment, we have 4. Okay, and basically we are the first hospital in Hong Kong, as well as the world, in bringing the MR simulator into full service. We will have full laboratory service, cancer genetic laboratory, chemotherapy, and the laboratory. Now the chemo lab has been licensed for the past 2 years, so it will continue. We will have radioisotope treatment facility, 4 radiation bunkers at the present moment, with the MR Linac, 2 Radizac, and the Linac. And by next year, we will also have the 2 gantry proton therapy. That will bring us to a very substantial oncology capability. Now, to look at it, this is a picture of the gantry under construction. You notice the size and the scale of the building. Okay. Okay. On here, you'll see that we actually will start inpatient services at AKN 3 around 2023, a limited service with 30 patients, and some OT. We are still negotiating the number of OTs we are opening up in the first instance. We'll gradually move all of the services in. Okay, this is the current look of the proton therapy. This is taken last week. Now that this is a synchrotron. Unfortunately, we don't have anybody standing there to show you the scale, and something that you need to see. This is the treatment room. We still haven't finished decorating the treatment room yet, and so that will be that is one of the things that are being done. All right. Dr. Lau is saying that to show you the scale. You see the two huge magnets behind him, and that is on a different side to the early pictures of the gantry. Now this whole thing rotates, and so it's an enormous, I think around 50 tons that we have to rotate in order to do the proton. And the question becomes, why are we spending our time on proton therapy? One of the things that proton therapy is known for is prostate cancer. The picture on the left shows a conventional way you do the prostate cancer. 6, 7 beams, anywhere from 8. This one is using an 8-beam proton to irradiate the prostate. On the right-hand side, you see the picture of a proton therapy using 2-beam system. This is now the common technique for treating proton. Now, how can we do that? Because if you see the conventional radiotherapy, you see the radiation beam penetrating all the way through, not just the cancer, but also the whole entire body. And that causes a lot of additional radiation. Whereas if you look at the picture on the right-hand side with a prostate, you have very little additional irradiation. The reason is something called Bragg's peak. Bragg's peak is when you shoot a proton through the body, it will attenuate as it passes through the body. When it loses all the energy, at one point, you will come to the Einstein equation of E = mc squared, where all the mass of the proton turns into pure energy. It's a radiation energy, and it uses up all of the energy right at that point. You see the photon, you see the picture on the right hand, you see the chart on the right hand side is, you don't have any exit dose. The penetration of the Bragg's peak ends where the proton loses all the energy. Okay, you have a lower entry dose and you have no exit dose. That is what makes proton so good and so successful. However, okay, this is one of the key advantage of a proton therapy because it doesn't penetrate through, loses all of the energy right at the tumor. It doesn't do additional damage. Also, because of that, proton needs to be very, very precise. Now, there are a lot of problems associated with that. For example, how can you get the correct attenuation? How can we be sure that the tumor is where it is when you irradiate? How can we be so precise in the treatment of the proton? This is only the beginning of where the problem comes in, because it is so precise. It's such a precision instrument that, and it is not the treatment of proton is not the normal radiation oncologist training. So we will have to do all new training from here on out. Okay, as I said, the first patient is scheduled for July 1st next year. At this point, I would like to thank Mayo Clinic Arizona. Mayo Clinic Arizona, we have a lot of discussion and work with the Mayo Clinic Arizona. Our oncologists, our medical physicists, and our radiotherapists will be sent to Mayo Arizona later part of this year for additional training, so we can learn what they do and the best practice. And we would like to thank Dr. William Wong, who is now the head of the Mayo Clinic's radio-oncology department, for their help, for his help. And he will also be in Hong Kong when we start the machine, so he can guide us through this difficult time period. All right. Thank you very much. That's all I have.